Hello, my name is Christopher Rambert, and this is my presentation on AIDS HIV for Biology 6100. The overview of this presentation will cover some general information on HIV, some signs and symptoms for HIV, the efforts of the disease, some statistics, and treatment for HIV. What is HIV? HIV is the virus that causes AIDS. HIV-1 is the most common cause of HIV/AIDS worldwide, whereas HIV-2 is the most common cause of AIDS and HIV in West Africa. This infectious disease is not just limited to West Africa. As you will see in some later slides, that the statistics has proven that it's some here in the United States as well. The first case of HIV-1 in a human was detected from a blood sample from a man in the Dominican Republic in Songo in 1959. But AIDS and HIV is looked at to be a homosexual disease. There are three stages of HIV. You have stage 1 is the acute HIV infection, which is 2 to 4 weeks after you have been infected with HIV. Stage 2 is the chronic HIV, which is 10 or more years after you have been infected and diagnosed with HIV. And stage 3 is AIDS. During your time that you have been diagnosed, the doctors will start your treatment either when you're in stage 1 or stage 2 to minimize your chances of getting to stage 3. So they start your medication or your regimens within stage 1 or stage 2. This right here is a table, but it's a chart to show you the difference before you have HIV into AIDS. The blue cells are your CD4 cells. They are known as your T cells. They are your white blood cells that fight off infection and play an important role in your immune system. So the more you have, the better chance it is to fight the infection. As you see, as it goes over to the acute HIV, the red cells are known as your HIV cells, and they are attacking your CD4 count to make it to where your immune system will become weak as it progresses over to chronic and then into AIDS, to whereas your immune system can no longer fight the HIV/AIDS virus. Statistically, there are 1.2 million people living with HIV in the United States. That is about a 14%, which means that 1 out of 7 people do not know that they have HIV/AIDS and have not been tested. In 2018, more than 37,000 people have received an HIV diagnosis in the United States, which is about a 7% increase in 2014. This chart right here is from the CDC. It is the estimated HIV from 2014 to 2018. As you can see, it goes from 0 to a count of 10,000 people. And as you can look at it from the right to left, from left to right, it says that the African American gay and bisexual men in 2014, there was 9,800 new cases of HIV among this type of group, compared to 2018 when it was only 9,400. And go on down to where, in comparison to African American heterosexual men in 2014, it was 1,800, and vice versa to the 1,500. The diagnosis of HIV: patients who are infected with HIV usually experience some type of symptoms. We'll get into those symptoms later. The test to diagnose for HIV, you can do a home test, a saliva test, or a viral load test. Um, and when you go into the clinic, sometimes they will do a saliva test where they'll swab your mouth and they'll give you your results right then, or you can do the viral load test, which is basically that they're drawing blood and sending it off to a lab to determine whether you have tested positive for HIV or you're still HIV negative. Some of the signs and symptoms is, according to the Mayo Clinic, within a few weeks of having contact with an infected person that have the HIV virus, the person who is HIV negative will start to experience flu-like symptoms from a high fever, sore throat, and could experience some type of fatigue. There's with your dry cough, pain while swallowing, pain in the abdomen. Your groin area will have some sores or even swelling. You will have nausea, vomiting, watery diarrhea, and you will this type of infection is will also cause red blotches and unattended weight loss. You can drop your weight very, very quickly. Your viral loads. The viral load is the number of viruses that is in a clinical sample, usually expressed as the number of viral particles per milliliter, measured in an HIV and hepatitis C patient to determine if the patient antiviral treatment must be adjusted. If this treatment is not working inherent to the viral infection, the attending physician will change the type of medication. Your high viral load is approximately 100,000 copies. This means that the virus is at work making copies and the disease may be progressing quickly. Your lower viral load is below 10,000 copies and the virus is not actively reproducing as fast as it was if it was in a higher viral load, and the damage to your immune system may be slowed. Then you have the undetectable viral load, which is less than 20 copies. And this is where your doctors would like you to be if you are positive for HIV. This means that your medication is working, but it does not mean that you is HIV negative. Once you have been diagnosed with HIV, you will forever have HIV. Maintaining an undetectable viral load in a patient means that they can have a normal or a near normal lifespan, meaning that the viral load is down, your medication is working properly, is that it's so compressed to whereas that your CD4 count is high, meaning that that is helping fight off the infection. But even if you was to go and take another HIV test, you would still come up positive for it. Some of the effects of this disease, HIV affects your immune system. Okay. Although you take medication for it, just like any other medication, it can and cause side effects. It depends on the patient, and it also depends on the type of medication that the physician has you to take. If left untreated, HIV can cause weight loss, confusion, depression, liver damage, and or blindness. And that was from the Mayo Clinic 2020. In the treatment and prevention, there is no cure for AIDS and HIV. Once you get it, the doctor they would do random tests, blood work to see how your CD4 count is. Once it's at a certain number, they will start your treatment of different type of medication. Some of the medication for HIV positive patients are Complera, Odefsey, and Novar. They have just came out with some medication for HIV negative people who are more likely to be exposed to that, and there's Descovy and Truvada. Those are PrEP. Although you are taking Descovy and Truvada, it's not guaranteed, it's not 99.99% that you will not contract AIDS and HIV. So even though you are taking those type of regimens to be on the safe side, it is required that you go in and you get tested regularly every 3 to 6 months, depending on your sexual encounters and your different sexual partners. And that is my words cited page.